Scott, your background certainly is impressive, especially when it comes to, the world of nephrology. And so I think, a great question to start with is, pharmacists are very well established in how they can improve patient care, both within the healthcare system and in the community. But how does a pharmacist, really work with the physicians, with the patients, and nurses, NPs, all the providers, uh, to improve kidney health for the patients overall?
Yeah, I think that's a great question. And it's how pharmacists work is how they work in every other field, and that's collaboratively. Pharmacists need to work alongside other providers, whether they're physicians, nurse practitioners, nurses, and use our training, our expertise to better that patient. So for kidney patients, we want to work next to the providers, the prescribers, to ensure that the medications that are being dispensed, or I'm sorry, prescribed, are not causing any additional kidney dysfunction. So they're not nephrotoxic. But also, are they dosed appropriately based on that patient's renal function? As pharmacists, we know certain medications you need to adjust with every step of the decline of the kidney function, whereas others, they're good until the patient reaches dialysis. So having a pharmacist work collaboratively with those prescribers to ensure that they're prescribing medications that will do no harm. I also work with our providers to make sure that the medications are dosed appropriately based on comorbidities. So, we need our patients to be on ACE inhibitors, but just being on an ACE inhibitor is not enough. They need to be at a target dose or as close to that target dose as possible. So, getting on the ACE inhibitors, beta blockers for heart failure patients is really important, closing those gaps in care. And then on the patient side, pharmacists can educate patients about medications, about the intended effects. Why are you taking an ACE inhibitor? Why are you taking that beta blocker, that SGLT2 inhibitor? And then also warn them and educate them about expected adverse events. Pharmacists can also educate about their disease progression. In a prior role, I provided diabetes education to patients, education about the overall disease process, as well as targeted sessions, like how to build sick day kits that, everything you need is in one little container where you can, keep at the bed or couch side when you're ill, and you have everything you need, whether that's, a can of soup, some glucose tablets if your sugar goes low, and extra testing supplies. Pharmacists are also very well equipped, with direct patient interaction to teach people how to properly inject insulin or other non-insulin diabetes medications. So the opportunities for pharmacists to work to improve kidney care is not just focused on kidney meds, but the entire disease spectrum and comorbid conditions.
Yeah, and I think that's really important. And I'm glad you brought up about education. So I think education is a huge role for pharmacists in something like what you're doing. But can you talk a little bit more about your role as an educator in the nephrology space? I know you talked about patients. You do work with the providers, educating them, or what else? What else do you do in that?
Yeah. So as pharmacists, we go through education, pharmacokinetics, pharmacodynamics. And then when we're working with kidney patients, those two characteristics or those multiple characteristics become even more important. We know that the kidney plays a pivotal role in the excretion of many medications, and so doses need to be adjusted, like I stated earlier. It's not just lowering the dose halfway or a little bit. It's, a gradual dose decline if necessary, or excluding the medication altogether if the renal function dips below a certain point. And then pharmacists as medication experts need to provide medication education to other healthcare providers. I am constantly providing education to our nurse practitioners, as well as even some of our medical director physicians about medications. I did set up weekly education sessions actually with the company. So I spend the first 10 to 15 minutes of the hour that covering one small topic, and then the rest is really an AMA or Ask Me Anything. We typically dive deep into that week's topic during the AMA session, but on occasion I get questions from other clinicians about complex medication regimens, or if a medication is appropriate for a specific set of comorbid conditions. The first 2.5 months of that, I actually covered all the classes of diabetes medications. So we spent, 10, 15 minutes, one class, 1 week, and went through the pharmacology, the mechanism of action, all the different medications in the class, and then also their place in current treatment guidelines. And then, of course, being who we are at Strive and a kidney care company, we also discussed the appropriateness of medications in patients with kidney disease, including those on dialysis.
I like the AMA, Ask Me Anything. So it's really kind of what we're doing today. Um, and I'll piggyback off that last question about education. And in pharmacy, we talk a lot about medication therapy management, the need for comprehensive medication reviews. So what does this really mean for the patient?
Yeah, so a comprehensive medication review is, I think some people think of it as like a medication reconciliation. When you go into your provider's office, you get sat in your room and they just confirm your meds. That is barely scratching the surface of what a comprehensive medication review is. So the comprehensive medication review at Strive is we want to obtain the complete list of products that the patient is taking. So not just the medications that are prescribed, not just the medications that they purchase over the counter, but the vitamins, the supplements, even the homeopathic remedies if they're taking those, because that all paints a picture or helps to paint the picture of this patient's condition and their needs. We then have our nurse practitioners actually review the complete medication list, all the interactions, not just med to med, but also med to food and medication to disease state as well, looking for any issues that need to be resolved. Our nurse practitioners will also assess for compliance or adherence to their medication therapy, because the best medication in the world is not effective if the patient doesn't take it. And then our nurse practitioners will, because they're nurse practitioners and can prescribe medications and adjust therapy, they actually work with the patient and their other providers to do exactly that. They'll prescribe new medications. They'll work with other prescribers to discontinue medications and adjust doses so that the patient is on the most correct therapy at the time that they're meeting. At the end of these appointments, they do go away with a couple documents. One of them is a complete medication list. A lot of our patients are on 15, 20, maybe even 25 different medications. No one can memorize everything that they're on. So they go home with a list of all their products, and they're encouraged to take it to every provider to make sure that every provider has the same list and that they keep it updated so that it is a living document for them. They also get a medication action plan, which I keep calling a honeydew list. It's between the provider, the nurse practitioner, and the patient. These are all the issues identified, and this is how we're going to solve them. And these are the actions you as the patient need to take. And we're going to go over this every time we meet, whether it's monthly, quarterly, semi-annually, or annually, to make sure that you're making the adjustments as necessary and that no new issues have come up.